Welcome to another episode of Health Matters with PA Lynn Szabo. I'm Heather Poland. What are we going to talk about today, Lynn?
We're going to talk about Ozempic and Ozempic-like drugs not being covered by Medi-Cal anymore as of January 1st. So as goes Medi-Cal, so goes the other insurances. And mainly they're doing this because the medication is too expensive.
Oh, wait. So like if Medi-Cal doesn't cover it, then private insurances won't either, or Medicare won't?
Eventually, I don't think they will. They might for certain indications, but for just straightforward weight loss, no. They're not going to do it. They would cover it, for example, if somebody was type 2 diabetic and they were having a hard time meeting their glycemic control, or they would cover it if somebody personally had coronary artery disease. But I used to be able to say, look, obesity is like the fourth diagnosis. Prediabetes is in there, sleep apnea is in there, hyperlipidemia is in there, and oh, by the way, they're obese. And so I used to be able to get it for the kind of associated diagnoses and not have to come out and say obesity, because you can only put 3 in at a time. Okay,
so just like a cumulative effect, this person needs this for the overall, they're pre-diabetic, They've got heart issues.
Right. I used to talk around it.
Okay.
And now they're on to me, I guess, and probably my other fellow prescribers.
Is there like a date when this will be cut off?
January 1st. But I know at UHS, the pharmacy is practicing early, I guess. And they are telling us they won't fill it unless it has these certain diagnoses on it. And that's really going to do two things. That's going to limit the number of people who have access to it. And it's also going to be the people who finally do have access to what's a really great category of drugs only have access to it when they're sicker. So not when they're not as sick, but as their obesity-related disease progresses.
Okay.
And they're sicker.
Dang. Yeah. So instead of being like a preventative, let's reverse this now, we're just going to wait until you're really bad off, and then we're going to be like, okay, fine.
Right.
That doesn't make any sense.
Right. So the singular most effective medication for weight loss, and now it's being taken away. And it's not only weight loss. I have 40 or 50 people on this category of drugs, and I have some, and all of them are obese, but they also have significant sleep apnea, and Wegovy is FDA approved for sleep apnea. I don't know how they're going to get around that. Or somebody is...
And is that because it causes the weight loss so that you can breathe and get rid of the sleep apnea? Okay. Right. And then sleep apnea causes all kinds of heart problems and everything else, right? So that's okay.
So I've got one person on it specifically because of her heart problems. So I got the cardiologist to say it was a good thing. I've got one person on it because that person struggles with alcohol, and this turns off that part of her brain that is insisting that she drink alcohol. And so all these unexpected
consequences of stupidity are coming to bite us in the butt.
I was going to say this tool is unexpectedly useful in a number of different ways in medicine, and we don't have access to it.
They're taking it away.
Yeah.
Because you can't help people that are on Medi-Cal.
And I think it's going to be extended to full insurance.
How long do you usually does it take? Because you've been doing this for, forever and a day. How long does it usually take once something is no longer accessible through Medi-Cal for it to affect private insurance and Medicare?
Oh, I think it's already in the works.
I
wouldn't be surprised if as of January 1st they just cut it off. I had some problems getting it okayed at an outside pharmacy in the Bay Area because it wasn't the right diagnosis. But they don't tell you what the right diagnosis is. You have to. I give up at about 6 or 7 times of trying to guess.
Jeez. So they're just doing everything they can to not approve this to begin with.
Oh, yeah. Yeah.
That's ridiculous.
Yeah. And the specific reason is not safety. This is what's new about these weight loss drugs. It's not that they're finding out that it's unsafe. What they're finding out is that it's expensive.
But isn't it like long term? Okay, so it's expensive for the insurance companies, but isn't it better for society as a whole to get rid of somebody's sleep apnea to do weight loss so that they don't have the heart problems long term later and be more expensive, or loss of productivity for businesses, for time missed from work because you were ill and having to have more in-depth procedures done to maintain your life? I mean, it doesn't look cost effective to me long term. This is just a decision that's being made to profit insurance companies.
Short term, the insurance companies always hope that next month you're not going to be their problem. So they don't, that's probably month to month payment is as long as, they can see down that road.
So again, we're attacking people and their health to make billionaires trillionaires. And to make $1 trillion companies. And it's going to, oh my gosh. Oh, okay. Sorry.
Yeah, it's completely nuts.
It really is. It's insane to me that we continue to allow these things to happen.
Yeah. And I also think that and this needs to be said out loud in the medical profession and in the pharmaceutical industry. There's a certain amount of, you wouldn't have the problem if you just pushed away from the table. If you didn't have that second donut. If you would get off your butt and go, take the dog on a walk.
I can kind of see that to a point. Right, to a degree, right? You can't eat 12 donuts every single day, breakfast, lunch, and dinner, and then not expect it to have issues with your health. But we have made our food system so dependent upon big ag and rice, corn, and soy to put into our cereal, to put into Crustables that we sell at school, to put into all of these different things that don't have nutrients, so that we could have cheap food for poor people so that they can go back to work and make Walmart money, and they could make Fred Meyer money, and they could do all of these things and make billionaires into trillionaires. We have built our food system to be unhealthy. So you have to be incredibly well off financially, above what is the median income here in Del Norte County, to be able to afford fresh fruits and vegetables, to have the time to cook those things, to eat healthy. Our society is built on quick and easy, throw it in an Instapot and all of these different boxes, and it's a $5 meal to feed your family of 6, and it's full of salt, it's full of fat, it's full of all of these other things so that you'll choke it down, but it's not full of the nutrients that we need. So you're going to get more calories that way. So I do see where there's some personal responsibility, but then there's also the society that we have built is to have crap food and call it food.
Right. But what I see when I'm taking care of somebody who has obesity as a health problem, especially women, is like a lifetime of shame.
Yeah.
And they will sit in the exam room and they will tell me every time, every cupcake they ate, every, little mini Milky Way that was left over from Halloween. And, and I'm going, I'm not interested in any of that. I'm not here to shame you for that.
Yeah.
And if you just read a certain Facebook posts and stuff about people being asked to be weighed at the doctor's office, we don't give it a second thought. We don't judge people.
I can't remember the last time I stepped on a scale at the doctor's office. It horrifies me.
Yeah, but the amount of shame
yeah.
associated with it?
Yeah, I won't do it. I'm like, I just don't care to sit around feeling really bad about myself for the next 6 months. So I'm not going to do it. Thank you very much.
And so that leaves your provider without a really important piece of data.
Yeah.
And trending over time. So it becomes more than one piece of data. So I don't think anybody that has a problem with obesity is unaware that at least their food choices and their exercise choices at some point in their life may have had something to do with it. And, people are exercising, going to the gym, walking around their neighborhood, riding a bike, going to the pool. And some people are doing 400 minutes a week, which is well above the recommended 150 minutes. But that's what's being recommended now, 200 to 400 minutes a week in order to lose weight which should be a readily available drug.
Yeah.
So
it's just unfortunate.
Yeah. So the Ozempic-like drugs, just for review, include Wegovy, Mounjaro, and Zepbound. And anybody on these drugs should probably contact their provider about tapering off.
Do you have to taper off those drugs?
It is suggested that you do it. So when these drugs were first talked about at conferences, and I've been to a number of conferences that talked about them, and if you read in Up to Date, which is the most common medical library that's utilized in this county.
I'm taking it's Up to Date all the time? Okay.
Because
that's why it's called that? Okay.
Exactly. We're told to expect people to be on this drug for the rest of their lives. And everybody said, no, I just want a jump start. So the patients started talking about just a jump start. And I would say, no, it's expected that you'll be on this for the rest of your life. Or you're going to gain 2/3 of the weight back. And It doesn't matter how much you exercise. And it doesn't matter that you're only eating a lettuce leaf every meal. You're going to gain the weight back.
Why is that?
It corrects and the simplest way to say it is it corrects a metabolic problem and allows people to lose weight. And then when that problem isn't corrected and it comes back into being when somebody is off the drug, there's nothing they can do.
Gotcha. So I'm not trying to be all
sciencey.
Well, no, not sciencey, but correct in word choices. So when you say it corrects the problem, my brain tells me that fixed the problem. So if you had a physiological, speech impediments are hard, disconnect in your brain and you overeat because there's not that thing there or whatever it is. If those medications correct that, I would think that would go away.
It corrects it only in the time period that you're taking the med.
Okay, so I kind of look. Okay.
Otherwise, we could make everybody feel like they're 22 again. I mean,
thank you for the clarification. I just want to make sure in my head that I understood what you were saying. Thank you.
Right. So your provider could also pay attention to some of the new prescribing indications and consider if your particular care could be framed in a way that you could continue it, which is, creative charting, which I have always tried to do. I've always tried not to use these meds, at least initially with the diagnosis of obesity. I put like 4 or 5 of them on where I know there's FDA indications for them. So that's why I had everybody doing sleep studies for a while because that was one of the easiest ways to get Wegovy. And then I was trying also to put everybody on Zepbound instead of Ozempic, Mounjaro, and
why was that?
Wegovy, because Zepbound allowed people to lose the weight the fastest. And I'm being told, going to multiple conferences by different speakers, that if you stop taking the drugs, you will gain 2/3 of the weight back. And Zepbound, if you're going to lose the fastest, and you have to, and it gets taken away from you, and you're going to gain 2/3 back, at least it's 2/3 of a,
Of a lesser. Okay, so it's just math. So you did it for math.
Right.
Well, good on you.
Yeah, so, I'm kind of creative in charting, I guess. So
don't put that out there, Lynn.
Yeah. So providers initially expected people to be on these drugs lifelong, but without any credible medical information. Now they're talking about jump starts. But we were told initially it shouldn't be used as a jump start, that you shouldn't expect that. So people were told initially to do at least 150 minutes of exercise weekly and to follow a healthy Mediterranean diet. Now they're being told 200 to 400 minutes weekly and to emphasize protein in the diet, to cut out carbohydrates as much as possible and have 3 small meals a day. But there's a lot of judgy language going around the provider sphere implying that people just are going to have to put in the hard work. Newsflash, colleagues, they're already putting in the hard work.
Right. And again, the price, we eat all the carbs that we eat because they're cheaper. We can afford that. Nobody can afford to eat chicken even anymore, or to go buy pork and fresh fruits and vegetables on a regular basis. Even buying canned vegetables, the store brands, it adds up. It's expensive.
And the pharmacists are telling us we can put people back on less safe and known to be not effective medications for weight loss. I'm looking at you, Fastin. Phentermine there's multiple studies that show that it doesn't really work significantly, and especially not over time.
Jeez.
So I think what is going to happen is this is going to leave surgery as the best current alternative.
Like stomach stapling and banding kind of surgeries?
Yes, bariatric surgery.
Okay.
Which is very difficult.
Right.
Difficult for us in Del Norte because there's nobody locally that does it. I think there's a practice in Medford, and the best practice that I've seen is in Santa Rosa, but they don't just crank people through to do surgery. They make them join online support groups, and they make them look at the reasons, how they got here, and they kind of...
Doesn't that have its own risks?
Yeah. And it's, it's surgery.
Right? And it's, geez. And then you have to get them redone oftentimes.
And then, they don't always necessarily work. And then for the rest of your life, you're at risk for other kinds of problems with vitamin deficiencies and things like that.
Right. And then one of the things that I read a long time ago was when you've had that surgery as well, the likelihood, especially for women, to become alcoholics because nobody addresses it and it goes directly into your system. So instead of having a year or 2 years of drinking daily, if you have a drink, that it speeds up that process of physical addiction.
But I'm not surprised that it's at least hypothetically.
Jeez.
So we as providers are being told to taper people off the meds. And I haven't really done this because I've got a large number of people who are going to run out of meds. They're probably going to try and all refill them on the last day of the year. And so they'll be running out probably the last 2 weeks of January. I expect for most people, this is coming too late at this point to actually get an appointment with your provider, talk about a taper. It is possible to stop abruptly, but the weight gain is going to start to happen rapidly. And that whole... where the medication turns off that annoying little voice in your head that's going, yeah, the whole bag of Doritos right now, and make it so you can kind of ignore triggers that are causing you to eat is going to turn around probably in a week or two. So expect the return of appetite, expect a return to cravings. And most people will regain their weight back within a year.
Dang.
Yeah. So you can also expect a increase in blood sugars and blood pressure. So keep an eye on this.
Okay.
Even if you're not on it because you're diabetic, a lot of people are on it because they're pre-diabetic. So
okay.
I'm wondering if this is going to, like a rapid weight gain over the course of, a short period of time is going to kick them into actual diagnosis of diabetes, kind of a data-free zone, but I would keep an eye on it. And I would have people focus on protein and fiber and decrease carbohydrates, which is kind of the opposite of what we're telling people to do with the Mediterranean diet. Mediterranean diet is high fruits and vegetables with kind of a moderate to low amount of protein. So we're zigging and zagging in the other wrong direction. And then the amount of physical activity right during the winter for this area of the country is supposed to double.
So shivering doesn't count?
Yeah, I guess it doesn't. Strength training 2 to 3 times weekly. So it's not just like you can walk the dog or walk your grandkid and that counts as exercise. Now you have to actually, I think with strength training, you're probably talking about the gym.
So are we going to go to a 6-hour workday 4 days a week so that we have time to do these things and to prepare healthy meals?
Yeah. The next thought is that we're counseling people to manage stress. Well, what a great idea. How easy is that? And get good quality night's sleep. So if you have sleep apnea and you're not tolerant of your machine, how easy is that going to be? And they want you to count calories again, which has made people a little crazy in the past.
And it's my understanding that it's not really effective either at keeping the weight off long term.
Right. So that's my whole point. I think we're being handed a bunch of things that medicine knows are not going to work. And it's like distracting us for the moment, and we have a renewed vigor toward making the best effort possible. And then the reward is going to be gaining a bunch of weight back. And
so is this why you don't put a heroin addict with a brain worm in charge of the CDC?
Yeah, although I'm not sure how much he had to do with it. I think the big pharma just got greedy here. But I'm hoping to see some kind of legal action, which would allow cheaper versions of the drug and would force insurance companies to cover it. Because really, it's the only reasonable treatment right now for obesity, and surgery kind of, in my opinion, lags behind. And there aren't any. You can't put people on fasting. It doesn't work. And, I can't. There's a couple of other drugs that are used for obesity, like, again, along the shaming thing, a drug called Orlistat, which causes malabsorption and can cause people to have unpredictable, spontaneous diarrhea.
Okay, that's always fun.
Yeah. Can you imagine if that was happening to an overweight person in the middle of Walmart?
Right. Didn't we do that with the chips with the Olendra?
Yeah.
Yeah.
It's
No,
the same,
that's not a good idea.
It's the same basic idea. So there's not a lot of other choices that are really going to help people in the way that this has become significant help for them. So I'd like to see some legal action on it. There is a local legal aid agency in Humboldt County that they say that they can help people get medical treatment that's being not covered by insurance if they really need it.
Yeah, legal aid does lots of stuff, and they come up. It isn't based in Del Norte County, but it is for both Del Norte and Humboldt County.
So Legal Services in Northern California, www.lsnc.net. And I think they might have an 800 number, but it looks like there are throughout Northern California. So for our part of the woods, it's 123 3rd Street, Eureka, California, 95501, and the phone number is 707-445-0866. And what I'd like to see is a bunch of people get together and instead of being shamed, because that shuts people up when you shame them.
Yeah.
They should be loud.
That's kind of the point.
They should be loud, and they should speak their truth, because this is amazing what it's allowed people to do in terms of losing weight. So next week, I wanted to talk about some other things that are kind of coming up in the future that could be versions of this that are not injectables, but are actually pills that you take every day instead of an injection once a week. So stay tuned for that.
Okay.
Yeah.
This is absolutely insane to me.
It is.
We have something that's safe, we have something that's effective, and we're going to take it away.
Right.
Don't get me wrong, the price on it is insane too. The greed of the pharmaceutical companies is outrageous, and I'm all for slapping them upside the head and telling them to knock it off and they can't be doing these things. But just to blanketly take something away that's effective instead of addressing their greed and just punishing, all right, because it's on Medi-Cal. They're taking it away from Medi-Cal first. So we're just going to help the people who need the help the most. We're going to hurt you the most, just for fun. And
a lot of people go to compounded, and there's compounded drugs. And compounded drugs are somebody in a laboratory somewhere makes a different version of the drug, but it's not brand name.
Okay.
And there's a lot of things for safety that you might want to consider. It's not exactly the same, but it's cheaper, and it's perhaps available without insurance company interference. And, that is something that can be easily gotten in Southern Oregon. And I'm not sure that it's always safe. I'm not sure that's the solution.
Is ordering it directly from Canada a solution? Can we get this medication directly from...
I don't know what you're getting. When you order something online, people are trying to sell you something. I don't know that you're really going to be able to say, look, I'm really certain that this is what it says it is and also is safe.
Yeah.
Especially if you're winging it, because there's oftentimes no health care provided in that. So you need to have somebody to say, no, you can't just start on the highest dose or you're going to end up in the ER.
Right.
You need some thoughtful medical guidance. I have seen 2 people end up in the ER with compounded, because of compounded versions of these drugs.
Wow.
And
Do you know where they got them from?
Yeah, but I don't feel like I need to say.
Gotcha. That makes sense.
Yeah.
I did hear a thing today that made me laugh, and I'm going to share it now. It's kind of a joke. So what borders on stupidity? Mexico and Canada.
I was going to say doing the same thing repeatedly and expecting a different result.
Yeah.
But yeah.
Yeah, that'd be us.
Yeah.
Good Lord.
Yeah. Just awful. So I'm really excited about looking into what alternatives might be available. You're going to kind of trip up in the same problem because something's going to be a brand name and there's no generic available. Is our insurance company is going to want to pay for it? Is Medi-Cal going to want to pay for it, even though, it maybe is not as expensive as the injectable drugs, but it's still brand new. And, our whole focus on capitalism within medicine really makes people suffer. So I'm not sure what kind of good.
I survived the fen stuff, not taking the fen, but watching what it did to people around me. And there is no way that I would want to take something like that.
Right.
That hasn't had the length of study and people taking it and everything else that what do they call them? GL1 something or others?
Yeah. But if anybody listens on a regular basis, my first Ozempic-like drug for weight loss talk was like, don't do this. This is a bad idea. Here's all the historical reasons why it's a bad idea. And my second was, well, maybe it's not so bad. And now I think people really need this drug. They really need something that medicine knows is going to work. And they don't need to be chided about their efforts to control their weight with what they have to put in their mouth every day.
Yeah.
And then also with exercise that nobody has any time to do safely. So there are so many people entrenched in shame. It's so sad.
This is sad.
Yeah.
This is profoundly sad. And it's going to affect a lot of people in our community. I know a lot of elders in our community, they're taking this medication to control their type 2 diabetes that are benefiting from the weight that they've lost. And it's not substantial weight, but they've lost weight that they're not, they're able to move easier. They're not having problems with the arthritis in their knees or their back anymore. And they're controlling their diabetes. So
it seems to help with depression. And I think what's going to happen with somebody who has a comorbidity of diabetes is they're going to watch the A1C. And when the A1C goes into like a more what we call euglycemic or stabilized blood sugar reading, which is around 6, they're going to start taking it away from people if they drop below 6.5 or 7.
Jeez.
Is what's going to happen. So if you're doing well, then you get what helped you taken away.
Wow.
It's awful.
It is awful, especially when you consider that it's taxpayer dollars that goes to develop all of these medications from the pharmaceutical companies, and then they get to reap the profits and they get to set their pricing, and we're not allowed to talk about those things or to deal with it.
Right.
It is very unfortunate. We just need to have universal health care, and
what a great idea. we came close with COVID.
Almost.
Yeah, maybe one of the H1N5s will bring us down.
We should not have to suffer to have basic decency in our country.
True.
We just should not have to suffer to get basic decency. And I don't understand. We went from having compassionate conservatism where we understood these things and we could understand that financially it was beneficial to do these things and to invest in these things. And the upfront cost might be a lot, but over time it's saved trillions of dollars to put in millions or even billions of dollars into something today and save trillions of dollars on the back end. And we seem to have forgotten that.
Right.
Completely forgotten that. And let alone that we have forgotten how to be basically decent to one another.
Yeah. The shame involved is immense.
Yep.
It's awful.
Well,
anyway.
Thank you for this wonderful topic, Lynn. And I hope that the takeaway on this is that we should just be kind to one another and have some decency, and universal health care is a necessary thing.
Right. And the takeaway is next week we'll have alternatives in the pipeline. So,
Okay.
yeah.
All right. Thanks so very much.
Thanks. Bye.
I'll see you next week.